Welcome. We're just going to wait a couple more minutes in case more people join, so we don't have to kind of go over things twice. So we'll just give it a second. And if everyone who's here so far, it looks like everyone is. If you don't mind just muting your microphone in case so there's no background noise unless you're going to be speaking. We'll just wait a couple seconds. Okay, might be good. Oh, here we go. They're filtering in. Okay, okay, I'll go ahead and get started. I'll keep an eye on the waiting room. But hello, everyone. Thank you for being here tonight. I see some familiar faces and names, so really glad to see you again. As some of you may already know, my name is Stephanie Butchkowski. I'm one of the admissions director in the Office of Enrollment at Niagara and the School of Nursing Liaison, which I am so proud to be a part of. So this is a very unique event. We're all super, super excited about it. We have a special guest and we can't wait to let her kind of have the spotlight. But first, I'm going to have, if the nursing faculty and a current student that are here, if you wouldn't mind going around and introducing yourselves so everyone kind of knows who you are, that would be great. If you want to start, Dean Coyne, did you want to go ahead first?
Certainly. Thank you. Thank you, Stephanie. I want to welcome everybody here tonight. I think this is, it's quite impressive, and we appreciate you taking the time on a cold winter evening to spend a time with Niagara University. I am the interim dean, and I've been here with Niagara since, I think it was, July 2019. And this is a great team of faculty. I'm going to introduce Mrs. Holthouse, who is our office coordinator, and Professor Maria Gadowski, who is our traditional program coordinator, and then Jena Mashayekhi, who is one of our students who's here to talk. And we feel very strongly about our program, and what I would add to this is that starting off, what is different about Niagara is that we are a small and agile school. We can move and pivot when things kind of start falling apart, and that would be perfectly exampled when we look back at the spring with COVID and how quickly we were able to respond, working with our students and keeping them in clinical. So that's the number one thing. Number two thing is when you come to Niagara, you start as a nurse, a nursing student. You are, on your first day of class, you're a nursing student. You don't have to wait 2 years to find out. And then number three thing is our small classes allow students and faculty to be very close and to work with each other. We look at supporting our students. We are not a school that weeds students out. So when students have problems, we work with them. We have a progression retention committee, and that's a very important group that works with students and develops plans to help them get through. I'm going to hand it over to our program coordinator, Dr. Gadowski. She's an absolute pleasure to work with, and students just rave about her. Dr. Gadowski, please.
Hi, thank you, Dean Coyne. Hi, I'm Dr. Farsini Gadowski. I am, as Dean Coyne said, I'm one of the professors in the School of Nursing. I teach 350, NUR 350, which is concepts, and NUR 354, which is health assessment. I'm also coordinator of the traditional program, and I really enjoy working with our students. Also, I am a graduate of Niagara University. So I graduated actually with a degree in biology and then continued on with my nursing degree, and both are from Niagara. So I'm not only do I teach at Niagara, but I'm also an alum, and I can tell you that Niagara, I'm so glad that I chose Niagara for my undergraduate work. It was a great experience, great university, and I'm very proud to, continue and be a professor at Niagara. And I just, really enjoy working with everybody. I see that some of my a former student and who graduated is going to be talking tonight. And one of my other students, Jena, who is still in the program, both of them are just really great, and I've enjoyed working with them. And I'm just so glad to see Erin, because I haven't seen her in a few years. And you will absolutely love her talk. She's, wonderful. So who would you like me to throw it to now?
Hi, Laura, right? Did you have to turn over to Laura?
Okay.
Thank you.
I'll take it.
Well,
Hi, everybody. My name is Laura. I'm the office coordinator for the School of Nursing. I'm kind of the go-to girl. So I'm going to throw my contact information up in the chat room real quick. If you need anything at all, if you have any questions about the program, if you need any information, by all means, reach out to me. If I don't know the answer, I know who does, and I can get back to you and get you the information that you need. Tonight is really special to me. Jen is here. She's a current student. Erin's here, who's an alum. Erin graduated just as I was coming to work at Niagara. And this to me is a reminder of why I do what I do, because our students are amazing and they go on to do such wonderful things. Jenna is going to graduate this year. I can't wait to see what she does. And I'm so excited to hear from Erin tonight. She's just a delight. And she's just going to make us so proud. So, Erin, thank you for being here. Thank you everyone for coming. I'm going to put my information in the chat room if you need me, or if you need anything, just reach out. I'm going to turn it over to Jenna now.
All right. Hi, everybody. So like they said, my name's Jena. I am a senior nursing major at NU. So I'm going to be available through the whole event. So if you guys have questions or if you need anything, I'll leave my email in the chat box below. Feel free to email me about anything if you have any student questions. I'm a tour guide, so I can answer anything you need, anything regarding Niagara whatsoever. All right.
Thank you, Jena. And thank you, ladies, for all of that information. We really appreciate it. Well, my name really isn't Michael Freedman, by the way, that shows on the screen. So I'm using a different account. So I'll put my information in the chat box. Like I mentioned, my name's Stephanie. But please, as Jena had mentioned, if you have questions that you would like to be addressed or anything particular, or even specific, to Erin, maybe when she's done talking or while she's talking, please put the questions in the chat box. I'm happy to field them kind of towards the end, and we can go over all that, which will be great. But I'm sure you're gonna hear a lot of great information today. So while we're here, the reason we're here is to hear from Erin Leppien, who is a graduate of the Niagara University nursing program. As of 2017 is when she moved on from us and has done some wonderful things. And I really think that given the time that we're in, I thought that this topic of her working in critical care as a nurse and during a pandemic, I thought was really something to touch on. And I'm sure she's learned a lot, and Niagara's the education with us has certainly helped her through that. So I am now going to turn it over to Erin Leppien and let her tell you about her whole story. So thank you. Welcome, Erin.
Thank you. Hi, everybody. As Stephanie and everyone said, my name is Erin. I graduated from NU in 2017. I did the traditional 4-year program to get my bachelor's. I'm originally from Lancaster. I went to Lancaster High School. I still live in Lancaster now. Guess I'm like a homebody. I don't leave. So that's kind of where I started. I originally, when I was looking at schools, I looked at 8 different schools. I applied to all of them. NU was definitely my top school. It kind of hit everything on my checklist. I really wanted a smaller school. That was more my preference. I never wanted to be in a class with like 300, 400 students. So NU's class sizes were smaller, which is what I liked. There were around like 25 students in a class, which was perfect for me. Really lets you get to know the professors too, and I'll kind of talk about that in a little bit too. The campus itself is gorgeous. If you guys have ever had an opportunity to go there, it's beautiful. So I loved that as well. And it just kind of hit everything. It wasn't too far from home for me. Again, I liked the small class sizes. I liked the feel of the campus. And NU is obviously known for its amazing nursing program. It's been known for that forever. They used to have the College of Nursing. Like, really well known. And I know when people say, oh, you went to NU, it's like everyone knows that they have a great nursing program there. So that definitely kind of gives you a step up and helps you there as well. So those are kind of the reasons I chose Niagara University. Obviously super happy I did. I got my job solely based on the fact that I went to NU, but I literally loved going to NU for nursing. So a couple of the things that the dean did mention, you start right away as a nursing student. A lot of schools, what they'll do is they'll break it up and they do, you know, your first 2 years, you do all your prereqs. And then your next 2 years, you're in your nursing classes, which is great. But a lot of the times what you have to do is reapply to get into those like nursing schools. So you'll get into school, you'll be there, you'll get your 2 years, your prereqs, and then you have to reapply to be into the nursing program itself. So that for me was just added stress that I did not want. I don't like stress. So I liked how NU was just right away. You started with like a foundations of nursing, I believe, like right off the bat, you were starting with your nursing classes. So I really liked that. The professors, when I tell you, they're absolutely amazing. I know everyone says that. Every single person is going to tell you, oh, the professors at our school are fantastic. I know it's a cliche, but they really are. I know, again, the dean was saying how everyone absolutely loves Dr. Mgadawski. I would walk into this woman's office, sit down and start crying over how stressed I was about things. And she was just there and she would talk to you, listen to everything. She was amazing. I would email her with questions all the time. She was definitely like the nursing mom for me. And that's kind of how all of the professors are. I cannot think of a single professor whose sole focus was to just not to get you through the program. Like that's all they wanted to do. They wanted to see you succeed. They definitely did not want to weed you out. This wasn't a program that accepted 600 students and then only graduated 100. That's definitely not what NU was. I'm pretty sure out of all of the people who started in my class, I want to say it was around 60 students, and feel free to correct me if I'm wrong. And all of those 60 graduated. I think there were 1 or 2 who decided that nursing wasn't for them, and so they left the program, but no one just failed out of the program. No one got weeded out. You know, everyone's focus was to make sure that you got through the program. And I did it. I passed my NCLEX in 75 questions, super stressful, was crying the whole time, but I did it. I got through it. So and they give you all of the resources and tools and everything you need. Another thing I really liked about NU, your clinicals. A lot of schools, so like I said, they split it up. You know, your first 2 years are prereqs and things. Your next 2 years are like more nursing focused classes. The way NU does it is you start right off the bat with these nursing courses, and we actually you start your clinical your sophomore year. So your second semester, sophomore year, you start your clinical. Most people won't do that until their junior year. So that was another big plus for me because that's a whole extra semester of doing clinical and getting the actual hands-on experience, because that's when you actually get to apply everything you learn, and that's when you get to see everything. So kind of connects all the dots for everybody. So that was a huge plus. The clinical instructors were also fantastic. So that was a thing for me. I would say one of the biggest things that helped prepare me to like really go, I forgot to mention this, that I currently work in the medical intensive care unit at Buffalo General. And I started there right as a new grad, and they do hire new grads into ICUs. It's not, you know, unheard of, but they do look for certain things in your background. Like, did you do your internships in a critical care, you know, in an ICU or the ED or anything like that? And for me, one of the things that NU offers is they partner with Catholic Health, and you have the opportunity to apply for an internship the summer before your senior year if you're doing the traditional program. And you can be, you apply for it, and you can either be on one of like their floors, you know, if you're interested in doing maternity or med surg, you can apply and pick kind of what you're interested in doing. They also had a critical care internship, which is what I applied to do. And I ended up getting that internship. I worked in the emergency department at South Buffalo Mercy the entire summer before my senior year. I did 3 12-hour shifts a week and then a 4-hour class, a critical care course. And that was actually with a professor who worked at NU at the time who taught the course. And so that was kind of cool because I knew him. So that made things comfortable for me. And I got paid. So it's kind of nice having on the reverse end, instead of paying to sit in class, I got paid to take a class. So that was really nice. And the whole internship was paid. So, and I think it was more than I was making at my other job. So that was cool too. So I got so much experience. That's 40 hours a week of just critical care experience. And they let you do everything because it's a paid internship. So you're not kind of just following around a nurse. Like, she made me work. So, I mean, there were days I got to put in like 15 IVs in one day. They just had me going down the line, like starting IVs. I got to participate in codes. I got to do chest compressions. I got to push medications. I got to start IVs while they were, actively doing CPR. I got to see intubations. I got to bag patients with, ventilations with an ambu bag. I got so much experience through that alone. It was awesome. And Catholic Health only does that internship with, I believe, at least when I was there, 3 schools that they got to do it with, and NU was one of those schools. So that was a huge thing for me. I definitely felt more just comfortable in that whole sense doing that. It gives you connections too. I mean, I got to meet the managers, I got to talk with them, you get to meet the nurses there. And then also all of that experience and knowledge that you gain, it was definitely something that made me feel super comfortable starting in an ICU right away. And I know other students from NU who did that, whether it was like a med-surg floor, labor and delivery, you're in a different type of ICU. They all felt more comfortable starting with their classes or starting with their jobs out of school. And then I got to do my internship for my senior year. They let you pick, you get to rank, like, your top choice would be this, your second choice is this, your third choice that, and they do their absolute very best to match you with exactly what you want. And of course I got exactly what I wanted. And I worked with a critical care float at South Buffalo Mercy as well for my senior year internship that you do through NU that you have to do. It's part of the game. And I saw so much more there too. I got to go to their neuro ICU, their medical ICU, their cardiac care unit, the ED. And then that was super cool because I already knew everybody in the ED. So, because I worked there all summer, and they offered me a job actually at the end of the summer as they called it, it's an immediate treatment assistant, which is kind of like an aide helping. And I was still able to do lab draws, sticks, and all the nurses knew me. So it was like, hey, Erin, we're doing something really cool in here. Like, come in and see what's going on. So that was really cool. And so then I did my internship with that critical care float, doing all of that. So by the time April came along and I started applying for jobs, it was like a no-brainer. It was easy peasy. I already knew so many people at Catholic Health. I knew the manager already from doing my internship there, my senior year. I already knew him, so he was interviewing me and I already knew him. And then, so that helped, and I got offered that job too. And then I ended up taking a job at Kaleida, but one of the professors at NU was close with the manager of the medical ICU where I work. At the time, she was the manager. So he had her and one of the other managers come in and talk to us, and I got to meet her and talk to them. And we ended up setting up like a tour, and it was me and I think like 10 other NU students who wanted to do this. And she put on a whole tour for us of Buffalo General and all the ICUs and the floors. And we got to talk to the director of nursing, and we got to speak with nurses who worked in the units, managers who worked on different floors, all because a professor at NU invited somebody to come and talk to us. So all of that, I talk really fast. I'm sorry. I hope you caught that. But like all of that were just opportunities that I solely got through NU. So whenever people ask me, how did you get your job? It's because of Niagara University. One of the professors had the manager come in, and she immediately said, oh yeah, when you go to interview, like I'll have your resume at the top of my pile. So eventually when the time came and I did go to interview, it's 2 interviews. You interview with HR and then you interview with the manager of the department you're looking to work in. I was expecting just to go to a meeting with, or an interview with the HR woman, met with her, and then she's like, oh yeah, the manager's ready to meet with you. So I was like, oh my goodness. Okay. I went and interviewed with the manager at the time of my unit, and she offered me a job right there. which I took because I knew that was kind of where I wanted to be. So that's kind of how I guess, progressed through NU, how I got my job, how it's kind of, it gave me this step up. I mean, you just get so many connections, which are super important, honestly, when you're getting jobs and everything. It's a lot of the times it's who you know and where you can get in. And you just allowed me to meet so many people, get those connections that I needed. All the opportunities it gave me made me feel so much more comfortable. So when I did start in an ICU right away, I wasn't terrified seeing a ventilator. You know, I wasn't terrified when there was a code because I'd been in 30 already. I wasn't, you know, I already knew how to use an art line. I already knew how a ventilator worked. I already knew how to put IVs in. That was like a piece of cake for me. So it was very nice to just have the background that I got, the experiences that I got. And I definitely have NU to thank for that. So thank you guys. So that's kind of what NU did for me to help me get to where I am. The professors, again, whenever anyone asked me what my favorite thing about NU was, it's the faculty in general. I worked in admissions while I was at NU. I was a tour guide, and then I was a co-director of student tours while I was there. And, you know, Stephanie reached out to me to do this because we're Facebook friends. We know each other. We've been friends for 6 years now. And, you know, I'm still keep in touch with everybody from NU admissions. The faculty there were fantastic. I still keep in touch. I talked to Laura a couple of times. She actually invited me to a different event for an alumni event with NU a couple of years ago that I went to. Dr. Mgadawski, I haven't seen forever. I miss you so much. I never got the chance to meet Dean Coyne yet, but it was obviously a pleasure to meet you today. But I was just so close with all of the faculty at NU, and you know, you definitely, again, this is another cliche with smaller schools. They say, you know, you're not a number. They know you by your name. But it really is true. I mean, I never had to start an email off by saying, hi, my name is Erin. I'm in your, you know, Foundations of Nursing 9 a.m. class. I don't think I ever once did that besides like the very first week of school, you know, as a freshman. Otherwise, I just said, hey, it's me again, sorry. And I got into my questions and everything. So, you know, I'd walk into their office, everyone knew who I was, and it's very nice. It was definitely like a second home to me. I miss NU so much. I would do anything to be back there right now instead of there being a worldwide pandemic, but is what it is. So I definitely loved NU and my experience there, and definitely helped me to get to where I am in terms of, you know, dealing with this pandemic too.
Yeah, Erin, I was going to say, like, how, I was going to say, you kind of go into maybe, you know, what does like a typical week look like for you now that we're in the middle of all this, or maybe when things first started, you know, how did it affect, you know, how the job was going for you, all those kinds of things, like how was it handled, and what is a typical day or week for you like in the midst of it all?
Yeah. So when this first started in March, obviously this is not something that we didn't know much about, you know, this new mutated virus. Obviously there's been different coronaviruses in the world before, but this is a new strain, obviously wreaking havoc over different countries. And now it's in the United States. So I remember they actually had construction and tarps going up in our unit. They were like getting ready to split the unit into a section just to keep the COVID patients in that little section. Little did we know, it eventually took up over our entire unit. There were a bunch of ICUs, that the surgical ICU, the neuro ICU, they were just all COVID patients. We ended up doing a makeshift ICUs in our PACU waiting room that had the non-COVID patients. So it's definitely something that we've never seen before. And it was kind of like, what do we do? You know, and at the end of the day, these patients are, you know, they have COVID, they end up getting a pneumonia caused by it. So we call it COVID pneumonia. A lot of them go into what we call acute respiratory distress syndrome, which we call ARDS for short, or ARDS. And so we treat ARDS, you know, the same way we would if it was caused by pneumonia. Okay, now it's just caused by a COVID pneumonia. So we already knew how to treat it, but it was tough when you have all of the patients that are this sick. So we got really good at proning patients, which is putting patients onto their bellies. We got really good at giving paralytics and, you know, proning and deeply sedating. And it was it was a lot. I definitely think that, you know, it's not something you're not prepared for. You're prepared to take care of sick patients. That's not something that was new to me. I think what was new is that it was kind of scary. No one knew what was going on, but luckily we had the PPE that we needed. We had our N95s and masks, and people were donating caps to us, and we had face shields and gowns. So we had everything we needed to, you know, be safe and to be comfortable. But it was weird. I was also orienting a new nurse at the same time this happened. So I'm trying to figure out all the new protocols and the new stuff that we're doing for COVID at the same time, trying to teach another nurse. And I'm like, I don't really know. We're just going to wing it, I guess, because this is brand new to everybody. So it was definitely, you know, you'd get to work, you pass your meds, you see your most stable patient first. So that way you're in the room less time, and then you move on to your sick patient. That's where you're going to spend most of your time. And, you know, that's kind of what your days look like. And luckily over the summer, things kind of slowed down a little bit. You know, we are a 34 bed unit. We had maybe about 3 or 4 patients with COVID over the summer. Now we're back to having the majority of our patients being COVID. So it's kind of, you know, you just pick up where you left off. The last routine we were a part of a lot of clinical trials. You know, we've been giving the convalescent plasma, which is plasma from patients who had already had COVID-19 and developed the antibodies. So you give them plasma from those patients in hopes that they will develop the antibodies and be able to better fight off this disease. We've been doing the remdesivir trials. We tried all of those drugs that you hear about in the media. We're doing all of those. And we're still doing trials now. You know, we have patients fill out consent forms to try new therapies. And so it's been a little crazy. It's been a little hectic. Wearing all your PPE for 13 hours is definitely exhausting, and I sweat a lot. So TMI, but it's true. And but I work with an amazing set of nurses who have become like another family to me, and they are able to make it all a little bit better. So we help each other, we get through it. It's definitely sad to see these patients, a lot of them die and they have no families with them, or just in general, they're stuck in the hospital for so long and they don't have families. So we try and do FaceTime. I've gotten really, really good at Zoom because we do Zoom and stuff too with these some patients' families, and just so they can see them. And I think that's it. It's definitely didn't think I would be doing this. I'd much rather there wasn't a pandemic, but I don't, you know, I never once felt like, oh my gosh, I can't do this. Like, I felt like I was prepared. I had a great education. I know my stuff. I'm able to take care of my patients. If I have a question, I ask. Always, never don't ask questions. Always ask, and you get through it. You know, we got through the first big wave of Western New York, and we're doing it again for the second wave. So is there anything else you want me to?
Thank you so much. Well, we actually had a question. Someone hopped on in the chat box here. As how long have you been, in case, I think he may have hopped on a little bit late, but how long have you been a critical care nurse, and what is your most challenging experience in the COVID-19 era?
Challenging. So I have been a nurse for a little over 3 years. In that entire time, I've been in the medical ICU, so critical care nurse for about 3.5 years now. I absolutely love it. It's definitely given me a lot of challenges. One of the biggest challenges I think with the COVID-19 is just, I think a lot of it has to be just the emotional toll that it takes on you a little bit. You know, all these patients, they come in and they're scared because you see what they see on the media, and now it's happening to them. And, you know, I had a patient last time I was at work, he was a young guy in his 30s, and he's like, I'm terrified of having to be on the ventilator and, you know, be flipped onto your belly and paralyzed. And unfortunately, that's exactly what we had to do. And that was what his fear was. So seeing how scared these patients are, you know, the families are scared, the families can't come in and visit. You do your best, you try and call them and hold the phone to their ear, you try and FaceTime them. So obviously it's a lot of physically tiring stuff too, when you're 13 hours on your feet going from patient to patient, and flipping 300-400 pound patients onto their stomach is not an easy feat, but we get it done. And so it's exhausting that way. But I think the emotional part, when I'm at work, I try and just totally block that out and not really think about it. I'm there to do my job and to help these patients get better. Then you go home and you realize, wow, it was really sad today. But all these other nurses are doing it with you. We're all in the same boat, and we kind of talk to each other about it. It makes it easier a little bit to help, and just to, that there's other people who understand what you're doing. But I think that's been the most challenging part, is just that, no one's ever seen anything like this. We'll have nurses in our unit who have been there for 30, 40 years, and they're like, we've never seen this before. And so it's just kind of all very new, and it definitely pulls at your heartstrings a little bit to see what these people go through. And you just try and help them and do your best and be the best nurse that you can for these patients so they can get better. We've had a lot of success stories, luckily. We had a board on our unit, and every time a patient got transferred out of the ICU, there was a little heart with the date that they got transferred out. So our board is full of hearts now, which is wonderful. It's kind of uplifting and makes you feel good about all the hard work that you've been putting in over the past 8 months. And we've gotten letters from patients and their families. We actually had one patient who was there for a really long time, and he was really sick, and he came back to visit us, and he looked amazing. So that's super rewarding in the end to see those patients succeed. But it's tough to watch and to see, people go through this, and you really feel for them.
Yeah.
Erin, what kind of protocols and what kind of things do you have to do to keep your friends and family safe? Because if you're on a COVID floor and you're exposed to COVID all day long, and then you come home, how do you keep yourself and your family and your friends and all those you're in contact from getting sick?
So in the very beginning, this was a huge fear of mine. I still live with my parents, and I was so concerned that I was going to get them sick. I think I stayed up in my room the first 2 months. I didn't do anything else in the house. Anytime I touched anything, I sanitized it. I was a little overboard, because it was new. You're scared. You don't know, could I have it? Could I not? Technically though, the CDC does say if you're wearing proper PPE, dealing with COVID patients technically does not count as an exposure, as long as you're wearing the proper PPE. So we wear N95, I wear a surgical mask over it. I have goggles that I wear. I'll wear a shield if we're doing procedures where, the COVID-19 can be aerosolized, like intubating patients or doing anything, doing such things like that. But we wear our gowns. So when I come home, I strip in the garage. I take all my scrubs off. I go right into my basement. I throw my scrubs in the wash. I go right into the shower. And that's my routine. I mean, that's at first when this started, I really stayed away from my family and everybody. Over the summer, when we were able to do things outdoors, I saw people just like a lot of people did. The rates were much lower. Luckily in this, excuse me, I'm losing my voice. Luckily in this past 8 months, I haven't gotten it. And I've been working with COVID patients almost every single day for the past 8 months. So obviously the PPE that we have works. I'm doing, proper protocol procedure. You go to work, you get your N95. And I put on all my PPE before I go into patients' rooms. You just have to be safe. We definitely sanitize a lot of stuff in the hospital, which, we always do, but they've upped their game quite a bit. And at home, I clean things. Kaleida, and I believe, obviously, I think Catholic Health does too, but they offer free testing to all of their employees. So there have definitely been a couple of times when I have really horrible allergies. So over the summer, I would start freaking out. Of course, I'm a little bit of a hypochondriac. You think I wouldn't be with being a nurse, but I think because I'm a nurse, I am. I think everything is a horrible death sentence, but I would get tested a couple times and my allergies were really bad. They were always negative, but it's free testing. So you can go whenever, however often you want. You could go every day, it doesn't matter. So they do that to try and make their staff feel more comfortable too, and just to make sure that everyone's being safe, if you are having symptoms, they immediately take you out of work. You go and get tested. If you're positive, you have to quarantine, obviously. If you're negative, you can resume working. We get our temperatures taken every day on our way into work. They have these cool little monitors now. You just stand there and put your face really close and it tells you what your temperature is. So that's cool. And so you just have to be smart about it. I don't do big group gatherings, even over the summer. If I saw people, I wore a mask. I just, my Thanksgiving consisted of just my immediate family. I didn't do a big thing, and I think everyone just kind of has to play their part with that. But I don't think I do anything much different than what the normal people do in terms of social distancing, just because we are, well protected at work, and, you got to keep living your life. And so I follow all the protocols and stuff that we have for social distancing. I follow everything at work, and I've been able to stay safe and healthy so far. So
Great.
Hopefully we continue that.
Yes, yes. So Erin, I'd like to, if you don't mind giving some feedback on this. So obviously the nursing curriculum is, very rigorous, kind of pretty strict with a lot of things, but you are also still very involved in things on campus. And do you have any kind of insight into, being part of such a strong program and pretty demanding, but also making the time for like other things like you did when you're coming in as a student?
So drink a lot of coffee because I'm a procrastinator. So I would stay up until 3 or 4 in the morning because I would choose to not start things until the very last minute. But no, in all reality, you just have to manage your time. There were definitely, I was very involved with the admissions, especially my, senior year when I was doing the tour guide stuff. There were some, between all the emails I'd be answering, there were some hours or weeks I'd put in like 30 hours a week, and yet I still managed a full course load. So it's really just up to, time management, and you learn what works for you. I know I'm not a morning person. To this day, I'm not a morning person. I don't know why I switched from nights to day shift, because I cannot get up in the morning. But you just kind of learn to find a schedule that works for you. So like with all of your classes, you just write out your schedule, you figure out, what you have to get done that day. And then you just have to kind of figure out, do you get more work done when you're in the library, when you're in your dorm room? And then that's kind of what you have to stick to. So sticking to like a good routine. Obviously, I always will say school comes first. And there's never been a time when any of the people I did other things with, faculty at the admissions office, I was also on some club sports teams. No one ever once said, well, like, what do you mean you can't come to this or that? Like, school comes first. So I always put school first, and I got my stuff done. And I feel like I keep saying time management, but you just kind of have to figure out a schedule that works for you, and you don't want to overdo it. But at the same time, you want to get involved. You want to have fun. It's college. Like, you want to be a part of different activities and, find your little nick and everything. And so
you need an outlet, you need that outlet.
Yeah,
to, absolutely.
you have to do something that has fun. Otherwise you're going to go crazy. So, which I did a couple of times, but like that's, so you just find what you do to like let off that steam and to have that outlet, like you said, Stephanie. And obviously make sure if your school comes first, make sure you get it done. If you're struggling, go see a professor. Like I said, they want to help you. They want you to succeed. They do not want to give you failing grades. They don't want to see you leave the program. I feel like the professors, like I remember a couple of times they found out we had another really big exam on the same day that they were having a really big exam. So they would change it. Like they'd say, you know what, you have this exam on Tuesday. Like, we were supposed to have this test on Tuesday. I'm going to push it to Thursday, because like that's a lot when you have 2 major nursing courses having the same test on the same day. The professors talk to each other. They know each other's schedules and stuff, and they really try and plan around that too, so things don't become like obscenely overwhelming. So they try and help you out as much as they can there. They're always there to talk to you and help you if you need help. I remember I had one professor who gave us her cell phone number. And of course, it was the night before I had a huge essay due. I'm texting her, asking her questions. And it's like, she knew I put things off to the last minute. So that wasn't news to her. And she was there 8 o'clock at night answering my text messages about questions for an essay. And so you just, you'll find something that works for you. it is a lot. It's a rigorous program. You know, there's a lot of studying, there's a lot of essays and tests and everything, but study groups help. There's in the library, there's a bunch of rooms designated just for like group things. If you wanted to do a study group, and you can reserve those rooms, which we did all the time. And then there's like big screens in those rooms and like a bunch of computers, so you can kind of form study groups for that.
Right.
And yeah, you just kind of have to figure out a schedule that works for you, but it's definitely doable. I know people who did D1 sports and were in the nursing program. So it's all up to you. If you make it work, you can make it work. You know, you just got to put work in.
Great. Oh, thank you so much. I mean, you did kind of touch on this, you know, already, and especially with talking with COVID and things, but I don't know if there's anything else left, but we did have a question with some challenges you face on a daily basis as a nurse. Is there anything in particular that you can think of, or that kind of happens a lot that you have to worry about?
I think the daily challenges would have to be, you really have to advocate for your patients. I hate when people say just a nurse. And I think the people who say that are nurses. They're like, oh, I'm just a nurse. And it's like, no, you're not. Like, you really need to advocate, because sometimes these, especially in teaching hospitals, you know, you have interns, you have, you know, residents who have been doing this for that long. And, you know, it's just as important that you know, like, what you're doing for these patients. So there'll be times when, you know, a doctor will come up to me and they'll say, oh, we want to do this or that. And I'll be like, no, we can't do that. And I'll explain my rationale. And then they'll be like, oh, okay. Like, so I think you really need to advocate. So just like confidence in that, which takes time, and, you know, it takes time to be comfortable enough to tell a doctor, no, I can't do that. And you'll eventually learn to gain that and to be able to do that. Other challenges are, you know, I'm in an ICU, things can go wrong at any second. You know, the last couple of shifts that I had one patient, we were doing massive blood transfusions and they were taking her to surgery in a few hours. And my other patient, I was deeply sedating, paralyzing, and proning at the same time. So there was like, you kind of have to really prioritize, okay, what is something I absolutely have to do right now and can't wait? And then you start with that. You know, you just do the one thing at a time, you get what you need to get to done. But being pulled in a bunch of different directions, and, you know, the one thing with COVID too is these patients are very sick. And if you have two very sick patients, you know, you'll be in your one patient's room and, okay, you solved 5 problems, but now your other patient has 6 problems. So you kind of have to find a good balance and make sure you're giving, you know, your patients the best care that they can. But I think just being able to advocate for your patients and to be able to time manage at work, and, you know, what problem requires my attention the most now, and take care of that and then move on to the next one. So just kind of prioritizing your problems and just making sure that, you know, all of your patients are getting the best care that they can, because, you know, it's busy. It's been very busy the past 8 months or so at work.
I can't imagine. I can't imagine, actually.
Yeah.
That level, no way.
But so you definitely got to figure out what's the most important and go do that one first. So, but
oh God, such great information. I mean, you're doing so wonderfully. We're all so proud of you. Oh my God, everything that you're doing for yourself and everyone else around you, right? So,
thank you.
Now there aren't any more questions in the chat box, but I wanted to kind of open up. We're getting kind of close to the hour mark, but is there anything else that from the faculty or from Jena possibly, you know, you just kind of wanted to share some tidbits that you think would be good for the students here to hear?
Yeah, I can go for a little bit if you want.
Yeah, please.
I just want to like highlight some of what Erin said too. When you come to Niagara, everyone wants you to do well. Like, that is the goal. The goal is to put you through 4 years, support you through those 4 years, and have you come out as a well-educated, functioning nurse. And so when you come here, like, you are kind of preparing yourself to succeed, is kind of what I like to say, like, when you choose to come to Niagara. No one is ever gonna like just like push you on your way and be like, all right, figure it out. Like, maybe they'll like kick you a little bit and be like, all right, go ahead, try to do this, but no one's ever gonna just like throw you off the deep end. Everyone really is there to help you Like even now, like I'm a senior and I have professors from my freshman year that I haven't had classes with since freshman year who I could still call and text and talk and use them as references for jobs. And they are your connections, they're your resources. And I have friends who go to nursing, who go to other schools for nursing as well. And I'll tell them like some of the things like I've done and like some of the things that I've been able to do because of my professors and the people I know on this campus. And they're all like, what? Like, really? They're like, that's cool. They're like, you know, at their hospitals, they go in, they do their clinicals and they leave. And that's kind of all they get out of it. They don't really meet anyone new. They don't get introduced to any of the managers on the floor. They don't really have as many opportunities to make connections out in hospitals like we get here at Niagara. Almost every clinical instructor I've ever had usually worked at that hospital, or if not a different hospital in the area, knew tons of people. If you wanted to go see a specialty that they didn't normally let students go see, a lot of times they could set that up for you. If you were interested in like wound care, they'd call a wound care nurse that they somehow know or that their friends know and find a day for you to go around and shadow with them. And it's just the little extra things like that that really makes NU like puts it above and beyond, in my opinion at least, that kind of like enriched my nursing experience here. So
I very much agree with everything you said. Another thing too, I can answer.
Jenna. Thank you for that.
Same thing with that like with what you were saying about clinicals too. You never have an issue getting a letter of recommendation. All of my clinical instructors wrote me a letter of recommendations. All of my professors would write them for me if I asked. Like, so just to help you, because obviously you want this education and to get a great education, which NU will give you, but then, you know, that what's the education if you don't get, you know, the job you want and get to where you want and stuff. Like that's the main goal, is to get you to succeed where you want to be in life. And so they are so able to help you with that. I got all the letters I needed. Like you were, I see NU students all the time in our ICU. I absolutely love when I'm being told I have a student and then I see it's an NU student. I get like so excited. It's a little embarrassing for myself. But so they're always there to help you, and they do make, what's the word I'm looking for? Like they will like help you if you wanted to do like certain types of nursing. They'll find a nurse to pair you with, and they all do work in areas that they've worked at, so they know everybody, and it helps. Like I said, connections matter, and it definitely makes things easier for you to just like get the job you want and be successful. So I agree with everything Jenna had to say too about the clinicals and the help the professors will give you.
Erin, I want to pick up a thread that you have woven through your very great sharing and your telling us how your experiences are, and that's the word advocacy. And for students, I know Mrs. Holthouse is nodding her head because she knows where I'm going. In order to become an advocate for your patients, you have to be able to advocate for yourself. And throughout the program, there are bound to be what we call either speed bumps or bibbles along the way. Like I said, we have a progression retention committee, and that committee works with helping students to be successful, to alter the plan, to change course, to help students work with their degree audit and get in the direction they want. One of the things that we constantly push is that students need to have that voice for themselves and speak to their faculty, speak to Dr. Mgadawski. Mrs. Holthouse is right there. I can hear her from my office talking to students, but as soon as something seems to be hitting the wall, we want you to come and talk to us. It's not a culture of blame or anything. We look for solutions. And the sooner we hear about something that's not going well, the better we have an opportunity to fix and to help the student. So advocacy is something that we want you to learn for yourself. And that once you are comfortable with that, becoming the advocate for a patient is a natural progression. So thank you. Thank you, Erin, for bringing that up.
Anyone else? I don't know if Maria or Laura, did you want to say anything else before probably start to wrap it up soon? Unless does anyone have any other questions they could think of too, please put them in the chat box. But any other additions you want to say, Maria?
Well, I just wanted to say that I did put my contact information in the chat box. So if you want to email me, my phone number is also there. So you can call me if you have any questions. Please feel free. I would love to talk to you. So if you have questions, please just feel free to call me. If I do not answer, I always, as I tell my students, please leave your phone number and your name so I can get back to you. But any questions, please just feel free, or you can email me as well, whatever's easier. Yes.
Great, thank you.
You're welcome.
Laura?
Yeah. There's just been so much tonight, Erin. I cannot thank you enough again for that reminder of why I do what I do as well. To see students succeed and to go on and do these amazing things, it's just really, really nice. I'm sorry. I'm so proud of you, and I'm so proud of all the students that go out there and do really, really wonderful things. And I will say this, and I do hit this on occasion because it took me a long time to understand this and to believe this, but as you go through the admissions process at Niagara, you keep hearing this Vincentian tradition, And when I first came to Niagara, I'm like, yeah, okay, Vincentian tradition. Everyone's nice for the first 6 months, and then it's all gonna, be just like anything else. Well, I'm in for 5 years plus now, and it is still such an amazing place to work. And that Vincentian piece that you get at Niagara is truly real. And it's just such a beautiful thing. And it's such a beautiful thing, especially in the field of nursing, to feel like you're part of something bigger than yourself, to feel like you're doing something for the greater good. And that is so thick on our campus and is so true. I just don't know what other word to use, because I was very, very skeptical when I first came to Niagara. And it has just been proven over and over and over through the students, through the faculty, through the alumni, through every aspect of Niagara University. So, everyone needs to go out there and look at schools and find the place that's best for you. But I cannot stress enough how important that piece is, and how true and real it is, and how blessed and humbled I feel to be a part of it.
Oh, we stayed strong for a while. Because I was feeling that way too when Erin was talking. I was totally feeling the same way, just the emotions were going crazy. So, well, if anyone, I'll tell you that, you guys, you can see, you can't get any more authentic than this, I don't think. So, and it's truly the case. And, I can say that in being, I myself have been at Niagara for almost 20 years, which I think says a lot. It's totally like a family, and our admission staff it's very, the longevity amongst all of us is crazy. It doesn't, you don't really find that in a lot of admissions offices, and we all have stuck together through a lot of things, and it's been wonderful. So it is totally like a family. And like the times that I've been on campus and stopped over to nursing for meetings and things like that, you can just see the warmth, and like when the students do come in and want to talk to the faculty or the staff or Laura, whatever, anybody that's there, it's just, you can just sense it, and you can tell it's just that they're their go-to people for sure. So I can definitely vouch for all that. But so I wanted to mention really quickly that a couple of people had questions about financial aid, and I just want to say that at 7 o'clock, I'm going to just do a little plug here. There is a financial aid Q&A session that my colleague is actually starting at 7. So someone, if you had some of the financial aid questions, I did put the link up above. I'll copy and paste it again, but it's there for you. If you would like to join, you can once you log out of here. So I'll copy it one more time. Any last minute questions? Is there anything anyone else can think of? Erin, I can't say enough about what a wonderful job you did and the experience that you're having, and just keep up the amazing work and keep making us proud.
Yeah. I'm
You're
so
welcome.
happy able to talk to everybody and see you guys again. And I can absolutely throw my email and number in the chat too. And if anyone has a prospective student, you have any questions at all, I'd be more than happy to answer them.
Oh, please do. Yeah, that would be great. Thank you.
And answered these questions. So I would love to be able to do that again. So feel free to reach out. I would love to answer whatever questions you guys have. I know you guys are going through a very tough time right now. I could not imagine being in school and trying to facilitate all of the stuff that you guys have going on with this virtual thing. So I really feel for you guys. And if there's anything I can do to answer questions you guys might have about anything, I would love to help.
You're awesome, Erin. Thank you so much. And another thing too, I just kind of want to mention, some may already know about this from the previous event we had last week, but I am doing, we are able to have some small in-person events. I mean, Erin, I know you're busy, but I'm just saying if you happen to want to stop in and you're more than welcome to. But okay. December 14th and 21st, myself along with the nursing faculty and staff are hosting kind of a nursing focus day. It was kind of short and sweet. Jena will be there as well. We're going to have also hopefully another student join us too, but it'll be just kind of about nursing itself. I've been able to come to campus though, which is great. And they'll do kind of a walkthrough of the sim labs and things like that. So we just really want the opportunity to try and bring some students to campus. Since we can do things at a smaller scale, we're going to be able to pull that off. And it's at 3 o'clock on the 14th and 21st. So please watch emails or any kind of marketing going out for that. So we'd love to have you guys there if you can make it. But other than that, I think that's probably about it. I think we'll wrap it up. I just can't say thanks enough to everybody for being here and joining us, and also all the information that everybody shared. Thank you so much.
Thanks.
Okay, great.
Buddy.
Thank you so much. Thank you.